Welcome to the wonderful world of wellness with Dr. Andy Mencia. This medical program heard from 7 to 7:30 each Saturday right here on WSBR 740 AM is brought to you by the Adult and Geriatric Center under the medical direction of geriatrician Dr. Andy Mencia. You're right, but he's not there anymore.
Good morning. How are you? Dobre utro.
Доброе утро.
Okay, so we have something important to talk about. Maybe this is your big day.
Yes.
Why don't you talk about it, Ina?
I'm going to walk out. Just let Ina run the show.
No.
Oh, please don't leave me by myself.
Okay, Ina, so tell us what's exciting at the Boynton Beach Office of Adult and Geriatric. It's called AGI Medical and Dental Centers.
Yes, on October 23rd, we're going to have an open house. This is going to be a first-year anniversary.
With the door open.
With the door open.
Not the windows.
At AGI Boynton location. And everybody is invited. The open house will take place from 2 to 7. And you can bring your friends.
So the 23rd of this month.
Yes, October 23rd.
It's one day before the Cure Symposium where Dr. Mencia is going to be one of
our
our
talk about
esteemed speakers.
And I guess we want to take an opportunity to really say thank you to Mike and all the staff there and you, Ina, because I know you travel to both offices to make sure they're running smoothly.
It's a gorgeous office. I have to tell everybody. It's
and
absolutely so spectacular. But let me tell you where it is. It's important you know that it's on Hagen Ranch Road. It's actually north of Woolbright. On Hagen Ranch Road, right at the address is 12453, but that's not going to help you. It's in the public shopping center,
the
right
public
there.
Shopping center.
Just get on Hagen Ranch Road, north of Woolbright, and you'll see it on the right. And it's all by it. It's next to. Let's see. It's Publix, and there are a couple of other places in there that we might. What else is there that people could look for that's famous? I guess there's the pizza place.
Allegro,
there's a dog
pizza place.
Yeah,
yes,
there's a
next
pizza
to
place in
Publix.
there.
but just look for the Publix, and it's in a very fancy neighborhood. They have all these
very
fantastic,
fancy,
big
retirement community and
wonderful communities
and gated communities.
Yeah, they're beautiful.
Yeah.
So Dr. Mencia, tell us what. When you first decided to open in Boynton Beach, is it because you had so many patients now coming?
Because we have so many patients from the West Palm Beach area. And it was hard for them, and they would say, we listen to the show, we love what we hear, and we want to meet you. And some of them started coming to me. One of the patients that was one of my, not my first patient, but one of the first few patients that started coming in, he was the founding father of Motorola in Israel.
Really?
And he listened to his wife listened, then he started listening because he had a condition that he was suffering from. And he and his wife have traveled all over. They have a lot of money, so they travel all over trying to get answer to their problem. And they say, well, you might be having Alzheimer's or you might be depressed. And the guy, he played tennis every day. He passed away. He used to play tennis every day. So I told him during the office visit, I said, no, I think I really want to check your heart. I don't think you have any problem with your brain. I think just your heart as a pump is not pumping well. So he agreed. And we took and put the echocardiogram right then and there while he was visiting, and I called one of my cardiologists and I said, this is a very important person. I need this person to be seen, and he come from far away. So in one visit, which made me very proud, very well deserved for this man for everything he had done. He was over 90 years old. And in one visit, we were able to find an answer for him.
Just like my husband when he came with one visit.
And his wife was saying, like,
prunes,
all the money you have spent going all over. And I've been telling you to listen to Dr. Mencia on the radio.
That's what you're famous for. You are such a diagnostician. And we never talk about this, Dr. Mencia. And I want you to keep talking about it. But if someone said, I want to go find a diagnostician, they don't know where to go. But I think we need to put that title. I think I have to do something. Wait. I have to add something in your article, and I want to call, because I believe you are a diagnostician. You
Thank
really
you.
are. You
Well, I really work hard at being a diagnostician. I really work hard at that because when you are a good diagnostician, what that means is, you have the two extreme in medicine. You have the, here you go.
I did it. No,
You
it's
did
okay.
it? Okay.
Thank you. He's giving me his pen.
Yeah.
See, he's a diagnostician. He sees
Yeah.
I need something. He knows just what
Yeah.
to do.
So there's two extremes. You have the secretary and you have the diagnostician, and then you have everybody in between in medicine. So the secretary is the one that you come in and they say, oh, you are depressed, go and see a psychiatrist. Or you have something on your skin, go and see the dermatologist. Or you think you have a problem with your heart. No, I know you have a problem, but you think you have one, then go and see a cardiologist so they can make the diagnosis for you and then come back to me. They don't take responsibility. And when the patient comes to, especially a primary care doctor, when I teach the student from Nova University and FIU, and I'm teaching the student, I say, you have to tighten your pant, whether you are a man or a woman. When you take care of a patient, sometimes you have to tighten your pant and take control of their health care. So, and I say that because I come across so many doctors when I'm lecturing to doctors that they say, oh no, if I have that problem, if the cardiologist say not to do something, I'm not going to do it. I do whatever the cardiologist say. I say, well, why the cardiologist couldn't be wrong? And who knows the patient better than the cardiologist? Maybe you know the patient a lot better. Because when you go to your gastroenterologist, you go every 5 years to get a colonoscopy. Are you going to depend on the gastroenterologist to change medication, to take care of the patient? You see the patient every month or 3 or 4 times a year. The primary care doctor need to understand, or the nurse practitioner or the PA, that they need to be in charge. They need to be in control because it's their patient. They know the patient better. Of course, we respect the consultants, but at the end, the consultant might come and prescribe a medication, but then you are the one that know all of the other medication the patient is taking. And I recall one time I had a patient that they called me. It wasn't even my patient, but I was on call at the hospital. That's when I used to take call at the emergency room. So I was on call. So they called me and they say, this patient is going to need medical clearance to put a pacemaker. And I say, okay. So I go in the morning, no rush. I go in the morning to do the medical clearance. And it just so happened that another major emergency came in. So I went to the emergency room. I said, I have to see that other patient. Let me go and see the patient. So I started asking, not even the patient, the caregiver, about the history of the patient. And this little black lady sitting in the corner started talking to me. I said, doctor, you are the first one that come and talk to me. Everybody bypass me, and they go and take care of the patient. They look at the chart. And I say, the chart makes no sense to me. Everybody's saying different things, so I don't know who do I believe here. So I want to talk to you. And so I told them I'm a geriatrician, but I'm going to be the primary care doctor, so I'm going to clear your patient to go for surgery. She loved that I say, your patient. Because she's the caregiver. And she had been with the patient like for 6 years or plus. And she said, doctor, she was doing fine. Then a month ago, she went to see the eye doctor. They gave her some drop. Then the cardiologist gave her some pill, and the primary gave some pill. And something is going on that suddenly now she needs a pacemaker. Does that make sense? I say it could. It could make sense. But what did the ophthalmologist give? Oh, it's a drop called optic. It's a beta blocker that can slow down the heart. I say, ooh. And is she using it? She said, yeah, I have it right here. I put it every night. I say, ooh, okay. So that's one beta blocker that can slow down the heart. The cardiologist gave her 2 beta blockers to slow down the heart so that they can control the blood pressure. And what the surgeon was going to do, the invasive cardiologist, what he was going to do, discontinue one of the beta blocker that slow down the heart, leave the other one, and put a pacemaker. So I put the surgery on hold. I say, hold the surgery. Oh my God, the surgeon, the invasive cardiologist, he was so angry. He called me and said, This is not even your patient. How dare you cancel the surgery? I say, because this person does not deserve a pacemaker. The patient is taking 3 beta blockers. Do you know that? I say, no, it's 2, and I discontinue 1. I say, did you see the eye drops? What eye drops? Did you talk to the black lady in the corner there? That black lady been with the patient for 6 years. Did you talk to her? I don't know. You better be right. If this patient dies, it's going to be on you. I say, good. I'm taking responsibility. And so we discontinued the eye drop. The next day, her pulse was in the 80s. So he had to put her back on the other beta block.
I am so angry about this conversation.
Yeah,
I mean, you see this, don't
this
you,
happened
Dr.
This happened
Mencia?
day in and day out. This happened day in and day out. And that's, one of the things that make me very happy about the home visit program that we have is because, you get this poor patient that go into the hospital and they lose total control of the medication. We should be ashamed as a society that if you go into a psych hospital, you can decide, you as a patient, you can decide whether you are going to take a medication for schizophrenia or not. But when you go into an intensive care unit, you make no decision. They start consulting and seeing the patient, and the cardiologist will come in and start this one and start that one. Nobody come to the patient and say, we're going to start this medication. You have the right to refuse. Is it okay with you if we start? We don't do that with patients. When you are in intensive care, when you go with chest pain, when you go with shortness of breath, we just start making treatment decisions. And as a society, we have to revisit this. Because why in psychiatry, we are able to decline and say, no, I'm not taking the antidepressant. I don't want that. Or I don't want even antipsychotic medication. You can say no to it. And in medicine, in the rest of medicine, you have no control. And why is that important? You'd be amazed how many times we go and do a home visit and we have a patient that is on the same medication twice. Why? Because hospital is a business, okay? Hospital, even if they work on a budget, it's still a business. Otherwise, you're going to go down. If you are spending more money than what your budget is, you're going to lose. Or if you are a for-profit hospital, you have to make a profit. So how do we make a profit in a hospital? We buy the cheapest medication there is, and when the patient is there, we give them the cheapest thing possible. And when we bill the insurance, we give you a Tylenol. We bill $125 for a Tylenol that you can buy on the street for whatever. It's a business. So when a person comes in, a lot of times you come in with hypertension, and you might be taking a medication called Norvasc. When you go to the hospital, they are not going to give you brand. They give you amlodipine, which is the same medication. But the patient is not a doctor or a nurse practitioner. So they go home and they say, they gave me a new medication. So I had to take my Norvasc that I was taking before, and now they gave me a new one called amlodipine. So they take both pills, and they are both the same. One is generic and one is brand. And that's why, the visiting nurse and all of those things are so important with those patients, because they become the gatekeeper. They become the true gatekeeper to prevent the hospital from having a complication from being home.
I have to jump in here because I have so many questions. I am really upset about this, and maybe we have been doing something wrong with you. I think that, you're an excellent physician, but you do something that is spectacular. The diagnostician, but also when people come to you, they ought to bring all their medications. They ought to bring them all. And
to any doctor they go to.
But besides that, you need to explain what each medication does. Most people have no idea what those medications are for.
Exactly.
And that's what you do.
And a lot of time I ask the patient, do you know why you're taking this medication? I don't know. You know what? So I say, okay, first thing, they're going to be a point of education. We have to do some education here. And if you remember, we did one program which was for traveling, when people are traveling.
I remember the traveling.
And in the traveling, we spoke about allergies and we spoke about medication. And you have to know your medication when you go to another country, not only the brand name, the generic name, and why you are taking it. Because, there are medications like amitriptyline that we can use for depression, a high dose. But a very low dose is a sleep aid. And intermediate dose is a pain management medication. So if you're taking amitriptyline, or also known by the brand name Elaveo, you might be taking it to help you sleep, or to help you control your pain, or for depression. It's the same medication. So it depends on the dose. Why are you taking this medication? And a lot of times, the patient go to the pharmacy and they see this drug and they say, "Oh, you suffer from depression?" And the patient go, "No." "But why are you taking this drug?" "I don't know." And they want to stop it because I'm not depressed, I'm going to stop it. No, you have to find out from your doctor, why are they giving you this drug? What was the purpose of adding this drug to your regimen? And then the other problem that we have is polypharmacy. And polypharmacy is one of the worst enemy of aging. Why? Because we die because of polypharmacy. We damage our kidney because of polypharmacy. We damage our liver because of polypharmacy. A lot of times we damage our heart. Our heart will get enlarged and we lose the pumping action of the heart because of polypharmacy. We get people that suffer from chronic fatigue, no chronic fatigue syndrome, but just that chronic fatigue that they cannot do what they used to do. And they look at themselves and say, "I'm not depressed, but I have no energy." And that could be secondary to polypharmacy, because you're taking drugs that are dragging you down instead of lifting you up.
So polypharmacy. Well, this article, I have to do this in our November issue. I mean, this is fantastic about find a diagnostician, and what does a diagnostician do? Let's get down to the basics. What does a diagnostician do?
A good diagnostician is a person that, a good diagnostician, of course, have to have certain quality. You have to be a good listener. You have to have a good support system. And you have to think on the patient pocket. So a good diagnostician will work with the patient. Sometimes a patient have no insurance, and they come to you. Are you going to do all the tests and run all the money that will cost this person to get all the tests? Or can you just listen to their story and listen to the way they talk? That's what a good diagnostician. They are good observant too. They are good listener, good observant. A lot of times I'm talking to a patient and I say, "Have you ever been told that you have a goiter or a nodule in your thyroid?" And they say, "No." "You have any problem swallowing?" "Sometimes." I say, "Well, you seems to have a goiter." But I have not even touched the patient. I just look at them when they are talking because the thyroid tend to move up and down as we speak. You look at the symmetry of the face. You look at the way they walk. Do they lean to one side? Do they hold on to the wall? So a lot of times I like to see my patient, not in the room. I like to see them as they walk down the hallway. I observe them. So a lot of time, even if I'm in the room, I walk outside and I look at them. I look at my patient walking, how they are walking. If they use a walker, are they using that walker properly? A lot of time, you have those walker chasers. Mm-hmm. The walker is running in front of them, and they are running right behind the walker, chasing the walker. And we have to stop them and say, "Wait, don't be a walker chaser."
A walker chaser? Never heard that before.
This is supposed to help you walk. So you're supposed to step into the walker. You don't throw the walker in front of you. And, if you go to the supermarket and you want to use the cart to help you walk, don't throw it in front of you. You want to step under the cart so that every time you step in, then the cart becomes an aid to your walking. So you look at that. You look at, you see if the person is having, when they say, "I'm having shortness of breath," are they using the muscle of the neck to be able to breathe, or their abdomen to catch a better breath? And you see that with people with emphysema, people with asthma, or are they having shortness of breath, but they seem to be breathing normal, which then we think more of a cardiac situation. And we look at the vein on the neck. If those veins are dilating when they are talking, they might have a problem with the pump The heart does a pump. So a good diagnostician is a good observer and a good listener, number one. And then is a detective. Because you have to ask the right question in layman terms. So you have to be a good speaker. Sometimes you go to a doctor and you ask the patient, well, you went to see so-and-so. What did he or she have to say? And they go, oh, they say something was wrong, but I didn't understand. But what part of your body? I don't know. They were using some term I just really didn't understand, but I understood that something was not right, and I'm really worried. And they come to see me with their blood pressure elevated, the pulse is high, they are anxious. And then
we're going to let you continue in a minute. We're going to let you continue. Hold that thought.
Okay.
Hold that thought. This is Dr. Andy Mencia, of course, who is the geriatric physician. This is a show that he does every Saturday morning, The Wonderful World of Wellness. You can see why it is a wonderful world of wellness. And it's the AGI Medical and Dental Centers. Now, he's going to rush right out of the show, go down to Commercial Boulevard where he has his, it's actually his headquarters medical center. That's where he started. That's where he is, 1608 East Commercial Boulevard. Write this number down. Remember, it's Pencil Talk Radio. It's 954-489-1345. 489-1345. Go in and get your diagnostician. Go get a diagnostic of what your health is like. That's what we've been talking about. This is a perfect subject. And get your flu shot, too.
Get your flu shot.
Get your flu shot. I was down there the other day, and I forgot to get it. Don't ever let me leave without it. Ask me.
Okay, that's going to be enough responsibility.
Yeah, it's your responsibility. Take care of me, Ina. Okay, and then the other one, of course, is Hagen Ranch Road, 12453. It's out. If you go, it's just near Woolbright. It's a little bit south of Woolbright on Hagen Ranch Road. It's in the Public Shopping Center, and that phone number is 561-270-6494, 270-6494.
And we're having the open house there.
Oh, that's what we're going to talk about.
Yeah.
Open house, and they do beautiful open houses. Their food's always so good, and you're going to show them everywhere. You're going to be there. Anita's going to be there, among a lot of other people.
Yes.
Dr. Rosemary will be there, I'm sure. The whole staff will be there.
Dr. Arias will be there.
That's right. Wonderful. And Dr. Livingston.
Right?
Yeah. Did I get that right?
Yeah.
Okay.
Mm-hmm.
Okay. And that is on the 23rd. The 23rd, which is a Friday.
Mm-hmm.
And it's going to be from 2 to 7.
Correct.
2 to 7. So please be sure you want to meet Dr. Mencia, because he is so brilliant. Now, let's get back to diagnostician.
A good diagnostician then also looks at prevention, because it's not to treat disease. It's the beauty of medicine is when you can forecast and foresee what's going to happen in a patient. And I give you a good example. I had a patient that came in, and the sugar, which in the range, when you look at the range of the lab that people use out there, usually is less than 99 is normal. Anything less than 99 is considered normal. It won't be flagged, so it won't turn red or blue when you get your report. So everything looks in line, and you say, oh, look, my test is perfect. But then you go and take a closer look as a preventive physician, and you say, okay, under 99 is normal, but this particular patient, the sugar was 96. And I say, this is kind of too close for comfort. And a young patient, which should be maybe in the 80s or 96, I say, it's really too close for comfort. Let's do a hemoglobin A1C that tells me how your sugar had been for the past 3 months. And the person came to see me, a young lady, for weight loss. So we look at the hemoglobin A1C, and she was a 6, and you want to be less than 5.7. So then I asked her, I said, well, do you have family history of diabetes? She goes, yes. I said, well, you have the genes. And that genes are waking up. So I asked, when you did the blood test, did you fasted the night before, like we discussed? She said, no, I fasted the whole day before, because the last time I had blood test done by another doctor, my sugar was a little bit high. So I fasted the whole day to make sure my sugar was down. I said, well, we had to be a little bit more honest then. Let's work. We're going to help you with the weight loss. So there's a medication that we can use that help control the sugar without giving you low sugar level called hypoglycemia, but will help you lose weight. And she was so happy.
And with that, because we've run out of time, but Dr. Mencia. Dr. Mencia,
don't pull me away,
I know that, but I have to say,
Richard is going to handcuff me and pull me away.
I know he is, but I have to say, I definitely want to do an article on that, and I think we do have to start using the word diagnostician. We haven't been doing that, but that's who you are, and no one else does this that I know. If you said, I don't know what's wrong with me, I need to go to a diagnostician, we're adding that to your label. I really believe that's important.
Thank you.
Because you know that. You look at people. You're very intense. And you look at people and you know what's on with them. So thank you very much.
Well,
I will
coming
see
from
you.
a gerontologist, I'm honored.
I'm honored to have you doing this. This is what
and
people...
I'm honored to have you have me.
My goodness. This is the love fest, right? It is a love fest. I love this man. I love this man. That's right.
I say they left me out. We are honored to have you.
And I have your picture now. I'm going to put you on. I do have your picture, so we're going to get you in the magazine. I don't think we've ever done that. We're going to show how beautiful you are. All right. Thank you, Dr. Mencia. We'll see you next week. Thanks for listening to The Wonderful World of Wellness with Dr. Andy Mencia. Be sure to tune in each Saturday morning from 7 to 7:30 right here on WSBR 740 AM.